Let's review the terminology and what they mean. Chiari malformation is the same as cerebellar, tonsillar, ectopia, which is two different words for the same thing. This is where the cerebellar tonsils, meaning the lower part of the back of your brain, are actually sticking out of your head at the bottom of your head into the spinal canal where the head meets the neck. Chiari type 1 malformation is what this paper will be looking into. Type 1 may be associated with syringomyelia, which is a cyst or a cavity inside the spinal cord, and bone abnormalities, but can happen in the absence of both of those. Chiari type 2, or Arnold-Chiari malformation, is a tonsillar ectopia present at birth and nearly always associated with myelomeningocele, which is spina bifida. The following are the symptoms mostly associated with type 1s, type 1 Chiari malformation: occipital headaches, neck pain, upper extremity numbness and paresthesia, which is tingling or pins and needles, and weakness, and lower extremity weakness and signs of cerebellar dysfunction. Diagnosis for Chiari type 1 malformations is mostly done with MRI. There are different definitions based on different authors of research, but they measure how far descended down into the spinal canal the cerebellar tonsils go. Below the foramen magnum, which is at the opening at the bottom of the head where the brainstem turns into the spinal cord. Some define it as 2 millimeters, some even define it as 5 millimeters below the imaginary line at the foramen magnum called the Bayesian-Opisthian line, which is drawn from the front to the back of the foramen magnum. The diagnosis comes with or without symptoms present in the patient. This paper is to investigate the question of whether trauma, like a whiplash, can create this condition and what the mechanism and results might be as suggested by previous authors. Some suggest it might be that Chiari was there prior to the trauma and that the trauma made these patients symptomatic. Answering the question of whether cerebellar tonsillar ectopia are potentially created by trauma is difficult, as most non-traumatic patients do not have MRIs to see if ectopia is present. This study is a case-controlled study. It is designed to compare traumatic and non-traumatic patients with neck pain for prevalence of C.T.E, cerebellar tonsillar ectopia. Not only prevalence between trauma and non-trauma, car accident and non-car accident, but between MRIs taken standing and laying down to see if the effect of gravity has a change in the diagnosis. On to the methods. MRI images were taken of the neck and base of the skull of 1,200 consecutive neck pain patients, 15 years old or over, at 4 different radiology centers over a 3-year period. 600 traumatic car crashes, 600 non-traumatic. Half of the traumatic and half of the non-traumatic were each scanned upright and the other half sitting. So there are 4 groups of 300. 300 upright traumatic, 300 laying down, 300 upright non-traumatic, and 300 laying down non-traumatic. The Institutional Review Board approval was from the Spinal Injury Foundation. Sagittal sequences for the MRI, meaning which slices they looked at, were taken at the area where the cerebellar tonsils were at their lowest point compared to the Bayesian-Opisthian line, or foramen magnum. Films were read by 2 authors that are board-certified radiologists and that were blinded in regards to which patients were traumatic and non-traumatic, so there was no bias there, and positioned seated or standing. When the 2 radiologists disagreed, the measurement that was more conservative, more cephalid, was taken, meaning more higher, because we were looking to see which is lower. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support.